Good morning, good afternoon, good evening again, because I know some of us are in different time zones. So today we're going to be talking about emotion and its relationship with understanding music therapy, and so the role of music therapy in the domain of music perception and cognition. And before I start, I just wanted to, for those of you who are, because I know some of you are musicians, that remember last week when I was mentioning about the relationship between music and language, and one of the theories that I very sort of glossed over was I did not mention the name, but formally it's called the generative theory of tonal music. I did mention the authors, Litterdal and Jackendorf. I may have called Litterdal Leonard. I was completely blanking out and putting Leonard Mayer's name, mixing it with Litterdal, but it's Fred Litterdal and Ray Jackendorf, linguists, so the composer Litterdal and the linguist Jackendorf, who came together and brought this, really understanding this theory, taking that theory from linguistics and bringing it towards understanding music. And so I just wanted to put, this is the classic book that came out in 1983 for those of you who are interested in moving further and learning more about that in more exquisite detail. All right, so let's go forward with emotion. And before I can talk about emotion in music, I really do need to talk about what is emotion, because this is what underlies the entire field, really, of understanding music and emotion. And so we need to look at what the big questions are. And there are many, many, many questions, but I tried to condense them right to the core of what we're trying to ask. And so they involve, what is emotion? You know, does it have a purpose? What is its purpose? Are emotions and moods, are they even the same thing? And if so, or if not, how are they embodied in the mind brain? So furthermore, this brings to the next question of, well, which brain systems underlie emotions? Are they different? Are there different regions within the brain? Are they the same regions? Are they all the function of the same brain circuitry? Furthermore, how does emotion in the brain relate to then physiological changes that occur in the body? What is that relationship? How does emotion processing in the brain then interact with cognition, so higher order thinking, with motor behavior, so when you go out and actually do something, with language, when you express those emotions, and then motivation. Does that underlie why and how we perform certain behaviors? Not. And then the big question is, what is a musical emotion? So I Googled what I was curious. I was like, let me see what Google says. And I wanted to come up with this word cloud. And the reason why I put it here is because it really does reflect actually the current thought in the field of the brain sciences, which means is we do not have clear answers. I'm going to tell you that right now. When you look up the word emotion in the brain sciences, you literally come up with an entire host of definitions and theories and concepts, and this word cloud really shows that. I mean, all these words here, it refers to feelings, it refers to a temperament, it's a type of character, it's a sentiment, it's about elation, grief, anger, culture, smile, words. I mean, it embodies a lot of things. And so that really shows how chaotic this concept is, but also it's reflecting how in the field we do not have a clear answer to all these questions I just mentioned. And in fact, there was a paper not too long ago in 2012 that came up that reviews all the literature, and I had to just show the name of the paper because it literally says Emotion, the History of the Keyword in Crisis. And although it was done in 2012, you can continue to look further into today's 2018 to 2020 papers, and this continues. Of really trying to come up with a clear definition. And so what I did is I went through all these papers, like I'm gonna just pick the key sentences. And this is just a very quick summary of literally the different types of attempts that have been made to define the word emotion, which are, it refers to a relatively brief and intense type of reaction. It comes about as a response to the environment, so it actually leads to changes because of environment, and typically that goes under the concept of if there's a trigger that's involved. A trigger can refer to the external environment or to the internal environment, so the external is literally what's in your actual environmental space, and the internal is thoughts or memories, so the personal. With respect to moods, this ends up being also a murky area because moods tend to not necessarily, it's believed that they don't necessarily require a type of trigger. Somehow moods are thought of as lasting longer, they gradually occur, they gradually enter into being. Number of other components that enter into the definition of emotions refers to cognitive appraisals. So it's the idea that you identify a situation as X, as dangerous, as lovable, as engaging. There's an element of subjectiveness involved in emotions. So this concept of you personally feel afraid, but that doesn't necessarily mean that somebody else will feel the same way. There's a physiological arousal involved. So one thing is that you may identify emotion, but there's something happening in your body. So an example is that your heart starts pounding, and many other consequent physiological responses may follow. It's also about an emotional expression. So while you may identify what it is, you may be feeling your heart changing, but then also you tend to then express it in some form or another. In this particular example, you scream and call in a dangerous situation for help. Then there's the concept of, well, then once you do that, then there's this element of action tendency. So you're going to want to then behave, right? You in this particular dangerous situation, you're going to want to run away. Then there's the concept of emotion regulation. So once all of this has occurred and you find yourself in a safe space after you've run away, now you're going to calm yourself down. So you're going to regulate that emotion, and therefore you enter into a different type of emotional state. Now, I'm really just mentioning all these different components, different aspects. This does not mean that they occur all at the same time. This also, we don't know if this actually is a specific order. Maybe something occurs, maybe you actually identify before you actually feel what's happening physiologically in your body. Maybe what's happening in your brain is occurring first before you actually become consciously aware of the emotion. So this is really an open question as to whether all of these components coexist or not, and whether there is an order or not to these elements. Now, I thought I would just go really go back kind of to the beginnings of questions of what we call affective neuroscience. So affect is referring to emotions. So affective neuroscience is the field of understanding emotions from the brain sciences perspective. And we certainly have to go back to an evolutionary theory of emotion, and this does take us back to Darwin, in which he does talk about how emotions evolved because they were adaptive, and they allowed animals and humans to survive and reproduce. So basically, emotions motivate people to respond quickly to stimuli in the environment for the purpose of improving your chances of a successful survival. And what's interesting, and so you can see from these images here, which are drawings of a bear, a swan, or goose, I think, a swan, and a human, showing that the way animals express emotions, humans also express emotions. And it turns out that there are a set of physiological instantiations, physiological consequences that we actually share with animals. So this example is supposed to be, I guess, of a bear that's growling, a swan that is apparently also kind of angry or showing disgust, and a human. And you can see that the baring of the teeth, I mean, it's questionable, yes, but the idea here is that the way animals express particular types of emotions, we also express them in a similar fashion. And so it turns out that perhaps there are a set of basic emotions. So the basic emotions are basically 6, and they are happiness, sadness, fear, anger, surprise, and disgust. And they're basic because they are shared across all species, and they are shared across all human beings. So this means also across all ages, from the infant all the way to the 100-year-old. And they're shared across all cultures. So that's this question of if there is something universal about emotions, there are apparently these 6, and we exhibit the same physiological reactions. Now, I have here 4, anger, fear, surprise, and sadness, as opposed to the 6 I mentioned, simply because there is debate, actually, in respect to which of the basic emotions are actually universal. So that is an outstanding question. I do want to mention that despite the interesting and, of course, fascinating and very important theory Darwin mentions here with respect to emotion, I do not want us to forget that Darwin actually has also a lot of very unsavory theories, and he did make the remark that women are physically and intellectually inferior to men in the human species. So just keep that as an aside. So moving forward in terms of understanding emotions further, we can start to categorize them into different categories. And they tend to fall into three. I love this image that's actually from an article for talking to children about emotions, but I was like, you know, this condenses it beautifully. And so there are three categories. There's the physiological, in which the idea is that emotions are actually the responses of bodily changes. Another camp in terms of understanding emotions is that, well, no, emotions are actually responses from brain activity. And then finally, another camp of thinking in terms of understanding how emotions arise and why is that emotions actually are formed from thoughts and ideas and concepts. And this is really interesting to keep in mind because this is going to become very important in understanding the types of theories that have been attempted to understand musical emotions. Just moving forward with respect to the brain science aspect of it, I'm not going to go through all of this. The only reason why I put this image, I think it's just great to show that there are specific brain regions involved in the emotional experience. And so I just wanted to highlight that internally in the brain, we can see that all these areas, as well as the outer part of the cortex, are involved. So it really goes to show that emotion is a complex neural experience. That's really what I want you to get from this. And the only area that I want you to really just keep in mind is the medial prefrontal cortex, which is this part of the frontal part of the brain, and the orbital frontal cortex. This is going to become important in our discussion next week when we talk about creativity. So just keep those names in mind. Also important is the amygdala. This is for emotion processing. There's a lot of research looking from animal studies into human studies, really trying to identify that this particular area is involved in the emotion processing situation and experience, especially in understanding negative versus positive emotions. So we kind of have some answers. It's not all unknowns, as much as there are many questions. Some answers revolve around the following: that emotions have tangible biological functions. So this, again, is coming from the Darwin concept, that really it's about facilitating survival. And in doing so, we have to respond in a way of fighting or fleeing or freezing states, right? The second answer, and I put this in quotes here, is that emotional experiences and behaviors are observed in all cultures. So there is a universal response to a significant event. So that means that a particular event, now of course determined by culture, is going to lead to a type of emotional expression. And that fact is cross-cultural. Now, that doesn't mean that, well, actually what it means is that there are many more layers to it. And of course, different individuals from different cultures will exhibit different ways of expressing that emotion. I've mentioned these basic emotions. Now, certainly what this means is that understanding complex and mixed emotions, because certainly there are many more emotions besides fear, disgust, anger, surprise, happiness, and sadness. But all those other emotions pose a much bigger challenge. And the reason why it poses a much bigger challenge to the field of the cognitive brain science is because many other aspects become involved. So it's not just about baring your teeth or smiling, right? Or when you curve up your mouth and you sort of squint your eyes when you're smiling, or it's not just about tears. There are many more elements that come into play, which are body cues, to how you use your body, how you move your body. Also language, how you use language, linguistic labels, and how you represent that. So I'm just showing, really just putting these elements out there so you realize that this is an extremely complex area of study. There are many more questions than answers. And you can also see that there are different perspectives involved in attempting to understand this area. Now, okay, what about music? Well, we certainly do have an intuition, and there is research showing that music does express and communicate emotion to some degree. Another element we know from the research and also from intuitive experience is that emotion does regulate emotion and mood, and I put this I'm kind of using them synonymously, in some form or another. And it can be in a positive sense or it can be in a negative sense. However, we enter into this next question of, well, okay, if there are universal emotions, does this mean that there are universal ways of expression of those emotions through music? Because we do intuitively tend to say that music is the universal language. So what do we really mean by that? And one of the answers in the literature is that, well, it has to do with emotion. It's precisely because music is not about expressing exactitudes in the way in our conversation last week about language, precisely because music is implicit. Its emotion is implicit in some form. And so it's capable of expressing that. And so that's what makes it universal. And I'm gonna go a little more into that in the next slide. But just really quickly, in asking the question of, well, okay, music expresses some sort of emotion, but what type of emotion is it really? Is the emotion that's expressed by music the same as the emotions we express and deal with every day? So in other words, the death of a loved one, that type of grief that you feel, is that the same as the death of a loved one representation through music? And I bring this up because this has profound consequences for how we try to understand what is universal about language, but also in the types of research we actually do, so the actual methodology, how we actually test this in individuals to understand that differentiation or not. And this brings me to this really interesting research that it comes around 1956, and this was by Leonard Meyer. So he was a musician, a composer, and also a philosopher, and a really interesting thinker because he brought in the concept of psychology into the realm of musicology. And he mentions a really interesting quote in this book of Emotion and Meaning in Music, which is, music does not, for example, present the concept or image of death itself. Rather, it connotes that rich realm of experience of which death and darkness, night and cold, winter and sleep and silence are all combined and consolidated into a single connotative complex, which then becomes particularized in the experience of the individual listener. So the reason why I bring this up is because, let's break this down. What he's really saying is that, okay, if death has a set of universal physical characteristics like collapse or stillness, silence, then combining musical variables like rhythm, tempo, and loudness in any number of ways can, to use a poetic term here, onomatopoetically mimic those recognizable physical features and consequently elicit an image of death in the interpreter and listener. So that means that music pretty much, given its lack of semantic specificity, then functions as a communicative medium expressing concepts and emotions via connotative representations. So perhaps that is what makes music universal. And the theory becomes much more complex because then it also assumes that certainly, remember in our conversation about how we learn language and music, and we look at the different features and we take the different features of the building blocks of music, which are tempo, rhythm, pitch, loudness, and so forth, how that's extremely important to how we learn language. And so what this really means is that in his theory further, he says, well, we all implicitly learn the rules of our, not only our native language, but our native cultural music. And so that is what we learn. And then further, as we grow up and understand more complex emotions and more complex concepts in life, we come to understand how those different specific building blocks of music can then be brought together to express those higher complex concepts and feelings and situations in life. So when we address this question of musical emotions, it turns out that there are actually two main, now there are many theories, but out of, let's say, the umbrella theories, there are two main theories. And one of them is what we call the emotivists versus the cognitivists. And this is the idea. So the emotivists is particularly this side of the graph, in which they propose that when you listen to music, so the musical experience, you actually feel emotion. So when you say that that music is happy, you are literally happy, right? And your body is going through the changes of being happy. And your brain is going through all the different parts of the brain relevant to identifying and processing happiness are activated. And that goes for all emotions. The contra theory is, so that's this one of emotion is perceived from music but not felt, is the cognitivist concept. And that's saying that, you know what, when you listen to music, you don't actually feel the emotions. What's happening is that you are capable of identifying those emotions. You're able to perceive those emotions. So when you listen to a piece of music, you're able to realize that, yes, it represents happiness, but you are not physiologically happy. You're not actually going through the physiological consequences of being happy. So that's really interesting, because that's saying that on one side, you're actually feeling those emotions. And so what that means is that those emotions are actually similar to, maybe even the same to, everyday living and experiencing emotions when you listen to music. As opposed to those that say, you know what, no, the musical experience is actually different. It's maybe even more of an aesthetic experience. And so that, of course, enters into the realm of philosophy and really understanding aesthetics and concepts of emotion as this other realm of experiences, and perhaps then music. So when you hear a sad piece of music, that grief that you feel for someone, a loved one who has died, is not the same for that grief you understand is being expressed in music. And this has really profound consequences for then creating a computational algorithm, or creating a set of, if we want to convert this into robotics, and if we want to come up with a computer analysis of what emotion is, then we enter into a problem here, because if we still don't know how we humans are experiencing emotion, then how do we come up with an algorithm, a model to then represent for computational purposes? And I on purpose picked this very simple skeletal diagram of the situation of music and emotions that particularly comes from a paper from 2018, really to show you that this is a big question. We still don't have an answer to identifying how the emotional musical experience arises and whether it's the same as everyday emotions. And so the idea is that perhaps it's a mixed concept of these two things. So perhaps when we come to identify and make a particular judgment or appraisal of emotion in music, we actually are drawing from a perception module, which is saying that, okay, our body is going through different changes, and we're also integrating a feeling module where we just simply, we are physiologically feeling this stuff, but we're also identifying this in an intellectual sense. So it's both physiology and mentalization that is coming together here for us to make a judgment about music. And if that's the case, if we want to create a computational model, we're going to have to take both of these elements into consideration. And what that also means is that we're going to create a robotic system that's capable of dealing with us, is capable of interacting with us in some form or another, then that system is going to have to be able to understand the physiological side of it, so the feeling side of it, versus the perception side of it. So the more intellectual side of what emotions are. And furthermore, this brings up the question of, well, let's go back to this question of universality and about cross-cultural studies. And we have this interesting model that is still very current today, even though it was created in 1999, of what's called the Q redundancy model. So basically this is saying that listeners can appreciate affective qualities, so the emotional qualities of unfamiliar music by attending to psychophysical cues. And composers and performers draw upon these culturally transcendent cues and culture-specific conventions in order to express emotion in music. So let's break this down just a little bit. So the idea is that the familiar system is the one that you are what we call enculturated into. So this is your cultural system, the one you know, versus the unfamiliar system, so the other cultural system. And so the idea is that there are psychophysical cues, which refer to tempo, sound intensity, pitch range, timbre, quality of sound, melodic contours, so that then down, right? Dynamics, loudness or softness. So all of this is what is shared across all the different musical systems, sound systems. And that there are specific cultural cues that you've learned in your familiar system, so your own personal culture. You have learned the different cadences, the types of instruments that are used, the types of harmonic progressions that are used to express a particular emotion. And then there are the other culture, the one that is unfamiliar to you, that other culture expresses it in a different way. And what allows you to understand the emotion in another culture's system, in their musical system, is because of these shared psychophysical cues. And composers take advantage of this, and performers take advantage of this. So this is I mention this theory simply because it is pretty interesting in that it takes into account the universal features that underlie all of us human beings and that are relevant for sound and emotion perception. And it also acknowledges that different cultures are going to have different ways of expression. And the reason why we say that music is the universal language is perhaps due to this very situation that composers and performers take advantage of these universal elements in order to express particular emotions. And so that's why if you are a Western listener, a Western individual born into the Western culture, you are going to be able to understand non-Western music to some extent, just in the same way that a non-Western individual, when they listen to Western music, will also identify and understand to some extent the emotional expression in that Western system. And all of this comes back to, see, we always return to infants and human learning and just really the importance of how we really need to go back to understanding human cognition from infancy all the way through adulthood, because what this means is that, so this goes back to this concept of enculturation, which means culture specific, domain specific. So what this means is that there is a fractioning of emotional systems in different cultures and domains. And so as we progress through life, so starting in infancy, we're going to be sensitive to, go back, these psychophysical cues. And that is going to transcend all cultures, right? And emotional channels. And then as we grow older, so as we go into maturity, as we become an adult, we come to learn our specific cultural and domain-specific cues to emotional meaning. So we're going to learn that our culture is going to do X, Y, and Z, and our musical system is going to do like A, B, C, D to express particular emotions. And so it's because of enculturation that we are able to identify most specifically our specific culture and emotional systems as opposed to those of another culture. So this actually then therefore shows the importance of learning and the importance of open-mindedness really to other cultural systems, and how we need to, if we want to understand other cultures, and if we want to come up with a more global, more humanistic viewpoint to what emotion is and what music and emotion is, we really need to look at multiple cultures across time and across the lifespan of the human. So I mention this because the entire field of music therapy is really the empirical evidence that is used for the validity of music therapy depends on this research, really. And it's all and if our research is still kind of ambiguous with respect to whether people are actually feeling emotions or not, and if different brain systems are involved with respect to identifying different emotions, then we need to rethink then how we use music therapy in appropriate contexts. So let's talk now about what music therapy is. So music therapy is an actual established healthcare profession, and it is established because it particularly uses music to address a number of needs across the age spectrum. And the needs that are usually addressed refer to problems or situations in which an individual has issues at the cognitive level, at the emotional level, may actually have physical problems, and also social problems. And the idea of the music therapist is to use music in a non-musical, non-entertainment, non-aesthetic way. And so what do I mean by this? Well, the idea is that music is not to be thought of as this enjoyable experience. It's not, the music therapist is not interested in analyzing music for its different cultural meanings at the theoretical level. They're really thinking about music from the perspective of promoting health and wellness for the purpose of specifically alleviating pain, of improving physical rehabilitation, of decreasing stress, so for stress relief, for actually improving communication skills for individuals who have specific linguistic aphasias, for actually helping individuals to express or understand emotion, and for, in some particular cases, particularly in the case of Alzheimer's, for actually enhancing memory. So what this means is that there are specific beneficiaries to music therapy. And so this particularly means that individuals that have problems such as substance abuse, brain injury, physical disabilities, acute and chronic pain, children, adolescents, of course, both children and adolescents can be individuals that have these particular problems, and also elderly individuals. And with respect to the elderly individuals, the music therapy tends to focus specifically on issues of decline of learning capacities, memory capacities, and other cognitive situations. And before we talk about very specific therapeutic advantages of using music, we need to go back to the earlier concepts of music therapy. So we do know that across all cultures, there is a general idea of music, that music is associated with other activities for achieving overall health and wellness. And all cultures, we look throughout all human history, have agreed and have understood and thought of music as being relevant for the amelioration of both physical and mental illnesses. Pre-modern concepts of disease, so before really the 17th century, the idea of healthcare was more a concept of being something that was mysterious, and there was no distinction between the supernatural or the divine with what we today consider the modern concept of modern medicine or modern healthcare. And in the Middle Ages, specifically, we have from accounts, historical accounts, both in Spain and Italy, there was the concept of what was called tarantism. So tarantism was the use of music and dance to induce a certain trance-like state for the purpose of healing. Another term that is important to understand is shamanism. So shamanism is the idea that we utilize particular individuals as mediums to access the spiritual realm. And in these particular situations, ceremonies were done or performed to put these individuals who were going to access the spiritual realm within a context of music. So both music, herbs, concoctions were utilized to, again, induce a certain trance state or an altered state of consciousness for the purpose of attracting and bringing forth the spiritual realm. This is still practiced today. And the reason why I bring it up is because it considers to be integral to healing, communication with the spiritual world through the use of chanting and specific types of musical interventions. Now, holistic forms of music and healing based on spiritual concepts and values really is seen across many indigenous cultures around the world, and as I mentioned, is still practiced today. So I mention this because this is going to become core to later how we think of music therapy in the modern sense. Now, in the 1800s, we come up with what is now more modern medicine, so what's called the biomedical model. And we know that before, even as early as 1744, the development of a science, so this is really interesting, the development of a scientific theory of music therapy was shown in reports in Spain, for which music was actually used to treat physiological and emotional illness. So we know that from reports that exist from the 1700s, that was sort of the beginning of thinking about music in a scientific sense. And of course, this is during a time where we have a big change in the 1800s of thinking about disease and illness as something that can be diagnosed and can be treated, and that we can use different drugs and surgery to actually treat particular diseases and illness. And it's not just through the intervention of divine or spiritual realm calling. So we move to the 20th century, modern concept of music therapy, and there's a key turning point that occurs due to World War I and World War II. And we have to consider this because it was at this point in which all kinds of musicians were actually sent to veterans hospitals across the United States to play for veterans who were suffering from emotional and physical trauma as a result of war. And this happened both in World War I and World War II. And what was really interesting, specific in World War I, is that there was a notable change occurred. This actually led to the hiring of musicians by hospitals. So hospitals realized, they saw that veterans actually started to feel better, and their response from surgery was improving faster than those that were not listening to music. And so hospitals started to literally hire and pay musicians to come in to the hospital setting to play to patients. And so what this also meant is that now that there was a change in the concept of the meaning of music, there was now a demand in the ability of these musicians. So not just any musician, who played music as a hobby. Now they really wanted very skillful musicians to come into the hospital setting. So this actually led towards thinking about music and medicine as something that requires higher education curriculum, that actually requires instruction and understanding and learning. And so we know that the earliest known courses on music therapy appeared in 1918. And then there was kind of a moment of not so much happening, but then in 1926 at Columbia University. And that really was, we can say, the starting point of which individuals realized that we know the value of music. We realize that it can affect mental health and mental physiology and physical rehabilitation. And so we know that because music can do this, we also need to educate musicians in this. And so now there was an increased demand across now all universities and all hospitals around the United States for accepting this concept of music and therapy. But music as a scientific concept. And although it was starting to pick up, the real adoption of music therapy in curriculums actually did not occur until the 1940s here in the United States. And the first music therapy degree program in the world actually occurred in Michigan State University in 1944, so it was established. And there was actually still a period of back and forth because it was not actually until 1998, where we had the founding of the American Music Therapy Association. And that association brought together the American Association for Music Therapy and the National Association for Music Therapy, which was created in 1926, finally consolidated into the American Music Therapy Association in 1998. And so I mention these dates because, again, we see that the war was really the impetus for realizing the value of music in a healthcare setting. And that really brought on the educational setting across universities, the demand for really thinking about science and music together. And I don't want us to just completely focus on this world and this concept just in the US, but I do want to mention here really quickly that during this time of the 1920s, all the way in between 1920s and 1944, we do know that there are reports, actual physical reports that were written in medical journals in which physicians were starting to notice the role of music, and specifically it was in aiding, for example, in the relaxation of the patient during surgery. And one of the very first texts about music therapy, it's actually was unpublished, but we do have the copy of it, was in 1944, and it was by Harriet Ayer Seymour, in which she wrote about, literally, it was an instructional course in the use and practice of musical therapy, in which she delineated what all the different pieces of evidence that was coming out of these medical journals, and how that should be used for instructing musicians. What does it mean to create a practice of a scientific concept of music in music instruction? And so this led to the creation of research journals that exist today, which is the Journal of Music Therapy and Music Therapy Perspectives. And again, this was not just happening in the United States. So Argentina in 1948 also was using music in the clinical practice. In 1949, they actually also started creating training courses specifically for music educators and musicians. And this really set off a flurry of activity in the 1950s and 1960s, in which we saw, for example, in the United Kingdom, music associations were founded and training programs were immediately created. And so we have the British Society for Music Therapy and the British Journal of Music Therapy coming up with their own specific journals. And then we also see as well, we have a lot of interaction now happening because conferences are happening back and forth, interaction, communication is happening. So we see that actually a lot of psychologists and psychiatrists in Japan were also already using music as a type of treatment. In the 1960s, we see that music therapy as approached through courses. We're talking really about the higher education concept of educating musicians and psychologists into understanding music therapy into the healthcare setting. We see this in Scandinavia, Germany, Holland, Italy, Greece, Puerto Rico, Brazil, Denmark, France, or literally countries all over the world. 1970s, we also see now that Australia, New Zealand, Korea start founding their own associations. And the 1980s as well, China starts doing actual research and more significant research in this and cross-communicating with all of these other associations as well. Now, I do want to bring up that music therapy is usually combined with other therapies. It's not just music. It is also combined with other art forms, and other art forms include painting, drawing, creative writing, and improvisational theater. Another element that has become really interesting in the adoption of music therapy is the use of dance or movement training. Also physical therapy, so while physical therapy is being done, music can be used and implemented during the physical sessions with the physical therapist. Also occupational therapy, so those individuals that are working with individuals to think about their daily activities and how to be more proactive. Music is used as a way to, in conjunction with those sessions, as well as with speech therapy. Now, when we talk about, hopefully you're asking at this point, what do we mean by what types of music is being used? What do we actually mean by, are patients listening to music? Are patients actually engaging in creating music, composing music? Are they playing instruments? It's actually a mixed bag of all of that. What I mean by that is that In some cases, what will happen is that patients will simply listen passively to music, or patients will actually engage in playing instruments, either alone or in a group setting. Research has shown that when patients are performing together or playing instruments together in a group with other patients, they actually fare better. And so that brings up another question, which is, well, is it really the music that's helping them? Or is it the fact that they are engaged in a group setting of music making and playing? And there is not a clear answer. However, it looks like perhaps it has to do, we don't know. It could be the fact that you're engaging with other individuals together, and therefore you're bonding with them. You are sharing your experience with them. But because you're doing it through music, and because music has that universalism to it, that's what allows for that bonding experience. You see why I'm saying I'm not sure about the answer. Is it the music per se, or is it engaging with others, communicating with others that allows for feeling better, for relieving stress, for expressing your ideas, for expressing your emotions, and having others communicate back to you in a safe environment. So the types of activities that are involved really also depend on the individual's specific situation. So the way treatment happens, for example, with Parkinsonian individuals who have motor control problems, it has been shown that when they engage in very simple rhythmic exercises and type of clapping exercises in a group actually does stop the tremors. The problem becomes that when you take these individuals off of that type of activity, the tremors return. So it looks like it is a short-term benefit as opposed to a long-term benefit. And so that is an area right now of key research in trying to understand, well, how can we make the experience more durative? With respect to Alzheimer's individuals, this tends to be a more personal situation in which you can give music to the individual. And actually, it has been shown that when Alzheimer's individuals listen to music that they were familiar with from childhood, they will completely enter into another state of happiness, of interaction with whoever they're interacting with. And so this really shows something interesting, because if somebody with Alzheimer's who has memory degeneration still has memory for the music of their childhood, then this suggests that musical memories perhaps are distinct from other types of memories. And one thing really interesting here, if we've been talking about music and emotion this whole time here, what is the relationship? And if music is all about expressing emotion, then perhaps the reason why musical memories are distinct from other memories, perhaps it's due to that relationship it has with emotion. And these very basic underlying elements of language and shared parts of us humans and cultures. So that is also another very big area of research that really we're trying to understand and pick apart. And what does this mean for improving memories with these individuals who cannot remember people's names, or who cannot remember different objects, who don't even know where they live, individuals who have Alzheimer's. So perhaps by using particular musical interventions, we can help them to relearn. Another element that becomes really interesting is this following slide that I have here, which is specific for melodic intonation therapy, known as the MIT intervention. And this is actually a very structured treatment that particularly uses sung patterns that exaggerate the normal melodic content of speech. So remember, that's up and down contours. And there are 3 levels of increasing difficulty that individuals who have particular speech aphasias, speech problems, will engage in. And so the idea is that intonation works by translating prosodic speech patterns, so basically spoken phrases, into melodically intoned patterns using two pitches. And the higher pitch represents the syllables that would naturally be stressed during speech. So for example, patients learn to sing a series of two-syllable word phrases. So they'll learn to sing water, ice cream, or bathroom, or simple 2 to 3 syllable phrases like thank you or I love you. So they will go through very specific exercises of using singing to learn where the stress patterns are in these phrases. And so as the individual masters the simple to the more complex level, and what I mean by simple, meaning 2 syllable all the way to more full entire sentences, then we can see the individual improve. And what's really interesting is this particular image here. So remember in our discussion about language, remember I mentioned that there was Broca's area and there was Wernicke's area. So Broca's area is in the prefrontal cortex, and Wernicke's area is in the auditory cortex, near the auditory cortex and the temporal lobe. And remember I mentioned that these two areas are involved in speech. Well, the fibers that connect these two areas is what's called the arcuate fasciculus. And so that's what I'm referring to here when we look at these images here. So this comes from a study in which they looked at patients who had speech problems, speech production problems, and they looked at the arcuate fasciculus, so literally the number of fibers, so the volume of this particular tract between these two speech language comprehension areas. And this, in A, is the arcuate fasciculus before MIT, before that melodic intonation treatment. This is afterwards. Now, I show you this because this is really fascinating at multiple levels. One, this shows us that with intervention of basic melodic, so this melodic intonation therapy, with intervention of music in an individual that has a speech production problem, we see that the arcuate fasciculus after treatment actually improves. We see further growth of this tract. So this shows us that there is direct physiological evidence that music affects our brain. And it's powerful because no longer are we talking about the intuition that music, makes me feel good, or music makes me angry, or, music is expressing something, I don't know what, but it's I know it's there, I feel it, but we're really showing actual brain changes. And this is, I'm really just mentioning the surface level of all of this because we know that when you begin to study music very young, you actually show different gray matter, white matter. If we see those effects in the brain, the temporal lobe, we do see greater gray matter growth there. We do see that individuals who start learning music from very young looks like acquire language much rapidly, have a better sense of pitch and tone differences, of understanding emotions in a more nuanced way. So really there's a whole range of pieces of evidence to show that music has a direct physiological, biological, neurological consequence. And that is the evidence that's being used by music therapists to show that, look, when we use music interventions, so when we use music, whether it's basso, whether it is this basic type of simple singing, to clapping, to movement, dance movements, to just listening to music, to talking about the musical experience, to actually drawing out what you're seeing or thinking or feeling during the musical experience, it has a real effect on our bodies and our minds and our brains. And that is really what has become this is And this is something that I'm going to bring up in our final session when we say, what do we do with all of this brain biology, body, neurological, physiological evidence? And how do we take all of this evidence and bring it into policy intervention? Because we know that there is a very real effect in our bodies and minds and brains. Another thing I do want to bring up is perhaps you've heard of the Mozart effect. So the idea is that that if you give an infant or really an unborn child, literally some of those experiments had women putting headphones on their bellies, right? Because the idea was that if you give the unborn child, if you have them listening to Mozart or Bach or any of the, here we go with the very stereotype Western concept of elitist music. So if you give the infant that the musical experience, they're going to be smarter. Well, that is, it's been debunked. It is not necessary. No. There's data showing yes, and there's data showing no. And really what it amounts to, the reason why the data is a mess is because there are a lot of confounding factors. It really has to do with the exposure of music in the household. It has to do with the resources of that family and giving music to that infant, that child. It also has to do with also even different languages that are spoken in the context. And so in the environment, and also our hearing, our development of hearing is not full-fledged hearing, adult hearing in utero. So we don't even know to that extent that the unborn child is actually hearing Mozart or whoever it is in utero. So that also has led to a lot of research questions and methodologies of how do we really understand this question of what are we learning, what are we hearing as a child, and how do we make that correlation between what we listen to music-wise and other cognitive capacities. Now, we have a few minutes before class ends, and I do want to open it up to questions that I'm sure are coming through. So here we go. Are the different parts of the brain identifiable by physical boundaries or by something else? So yes, we can look at the brain. We do know that there are 4 main lobes of the brain, right? The prefrontal cortex, the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. So we can make those, there are boundaries to that extent, and also in terms of how the different cells within the different parts of the brain are, both in biologically speaking, so we can see those differences. But I do want to stress that really the musical experience, hopefully you're noticing, just by even looking at all the different brain areas involved in emotion, it is a full brain experience, and language is involved, emotion is involved, thinking is involved. What about the affective age? Younger people seem to prefer higher beat music than older folks. So you're really bringing up this question also. I haven't even mentioned it. There's this whole domain of personality and learning in music. And I think this is really an effect of personality and also environment. Yes. And that also is very murky and sketchy, I'm going to use that term here, to understanding personality, because there are stereotypes that certain personalities prefer certain types of music, right? So there's the idea that the intellectual, and I'm putting all this in quotes, the intellectual / introverted person is more attuned to the classical music, versus the extrovert is more for the jazz music. I mean, I'm putting all this as quotes, and I even find myself, I'm horrified that I'm even making these statements within the research world, even mentioning this, because this also has a lot of racial discrimination connotations in that. So it's a mess, what I'm saying. But I think it has really to do with also, it has to do with environment. Can music be used in a preventive manner, not just a therapeutic manner? We're referring to its effects on memory and cognition. How does it differ in each case? So yes, preventive versus curative. So certainly it has been shown that just by engaging in, so actually learning to play an instrument, literally learning that violin, learning that piano, it has a direct effect on your brain. So one of the hypotheses is that while that we know that happens in early childhood, if you do it later in adulthood, it actually does have, yes, a preventive type of, yes, it can prevent certain types of cognitive decline. So it's just like when they say later in life, continue learning, continue doing complex cognitive tasks. Indeed, it does help. So what is the evolutionary advantage of our brains being wired for music? It goes back to our previous conversations over the past, now in our third week, for language, for communication, for learning emotion during infancy, understanding how we express emotion and communicate with each other. How does music appreciation work at the level of neurotransmitters? Do we have dopamine? Or yes. So this brings up, thank you for bringing that up, because I should have had a slide about this, but there is, so you know how some of us experience, or hopefully all of us, who knows, experience chills. You know the little goosebumps you get when you listen to music? So that's known as chills. And it has been shown that when individuals are listening to highly arousing, pleasurable music, and they exhibit these chill responses, that the parts of the brain that are relevant to the dopaminergic reward mechanisms of the brain, they are activated. So that goes to show that there is a tight correlation between music actually activating reward dopaminergic parts of the brain, reward mechanism, parts of the brain, much in the same way that other activities like food, so eating, sexual activities, drinking water. So these very basic activities are necessary for survival, these pleasurable activities that activate these dopaminergic reward systems in the brain is also activated by music. So perhaps music, in a way, we can think of it as a natural drug. So and then we'll pick this up hopefully in our final week to when we really open this up to the conversation. So keep that as a ... At what age do children start to exhibit benefits, advantages of music therapy? Actually, so that's a great question. Really quite quickly. Because they are in this phase of really where we have neuroplasticity, right? They're in this learning phase. They really are we can see the benefits from the beginning. And it's probably due to the fact that they are still in the learning language, learning culture, just learning phase in general. And they're really open to multiple experiences. So all the literature, yeah, looking at different, and now, well, I do want to mention that it also depends on the particular context and the environment, right? So it depends on whether we're talking about children that have been, that they're in music therapy because of, let's say, abusive contact, which is going to be different from a child, let's say, who has autism, from a child who has specific learning deficit versus linguistics, or a language processing deficit. So it's going to depend on different circumstances, but they do, the effects are there, and they're very powerful, and they are, if not immediate, but after several sessions, and also in combination with other therapies, are very powerful. I enjoy the reading you sent from the music and language section. Do you have any other resources? Yes, I will do that. I will add more readings. I will, well, of course, the reason why I sent out the Oliver Sacks reading, I mean, he's a wonderful writer. He was a science communicator as well. The problem with a lot of the readings and this other parts of music that I've been talking about don't tend to be as narratively aesthetic, let's say. But I will definitely, there are some readings I can certainly share with you guys with the group. So I will do that. I will make sure that you get those. All right, so we're now right at, a little past time. So to be respectful of people's time, thank you all. We will meet next week and talk about, I think it's on creativity. Yes, creativity and robotics. So how does artificial intelligence enter into all of this? And what does it mean? Is AI replacing the human musician or not? ...